Hello friends. So in the last video we learned importance of the revision. Today we will learn how to do the stepwise revision. As I told you that these 120 days is gonna be make or break for your exam. So now let's learn today how to utilize these 120 days in the best possible way. So all of us have completed our first revision or the first reading and we have made our notes. Some of us have read the guidebooks, some of have read notes and made the thing. Now you will have to consolidate them. So see, we have got 19 subjects. So you have got anatomy, physiology, biochemistry, pharma, path, micro, FM, PSM, ENT, ophtha, medicine, surgery, gyneobs, pediatrics, and then you have got skin, anesthesia, radio, psyche and orthopedics. Okay. Now the point is, in the revision we will have to focus once again on all 19 subjects. Now there are two parts. You have to divide your time into two parts. Now first is you are supposed to do at least 2 revisions. Okay, so 2 revisions. So if I have 6th January, I consider the date that has been announced now. So leave the last 6 days. So you have basically October, November, December. So we will say 92 days plus you can say 15 days. You have 3 days for the vibe session. So 15 more days. So approximately 105 days. So I will suggest you then divide them into 70 and 35 days. 70 and 35 days. So in the 70 days, you have to revise all your subject once again and 35 days. Last the 6 days for the extreme revision that is there. So in the 70 days, you have to repeat all your 19 subject once again. Now, what you have to do is first you have to make a list of those subjects which you think are slightly weaker. You have completed your 19 subjects, but I am sure that some areas you must be lagging in some of the areas. So you have to take care of those areas first. Okay. So like if I say anatomy, physiology, biochemistry, usually this is one subject which is a pretty volatile subject. This is another volatile subject. Now these are scoring subjects. Anatomy is a very scoring subject, but yes, you will have to do it it has to be pretty strong. Path is a pretty scoring subject. You need to have a good knowledge. You need to take care of that. Okay. Then ophtha is a slightly volatile subject. And then these subject depending on, because these are not undergraduate subject, so most of the time students don't have a very great knowledge of these subject. So now what you have to do is first you have to see for which all you have complete notes. Now complete notes means that you have attended classes, you have made your own notes, or you have read those subjects during your MBBS, you have some of that consolidated part, or you have the institute books, you have consolidated that at one place. Now please remember, at this point of time your aim is to read quick in a way where you can read the subject in a pretty shorter time. So no long routes at this point of time. Okay, if you have read the subject wise books, I am sure that you must have consolidated them in the form of your notes. So no detailed books at this point of time. Please remember, I am once again repeating, no detailed books at this point of time. Okay. So the important things that you need to do in the revision is your notes and test. You can divide the test into 2 parts, subject wise test and full course test. Subject wise test and full course test. Okay. So these are the times that you have to pay attention to. Okay. Now how much time that you have to give to the notes and how much time that you have to give to the MCQs? That's the commonest confusion that you will be having at this point of time. So now it depends on how much have you read. So it will vary. Usually I will say that divide the time into 2:1 ratio. 2:1 ratio. That means if you are reading 9 hours in a day, read 6 hours theory and 3 hours MCQs. 6 hours theory and 3 hours MCQ. Okay, if you think that you have not done MCQs very well, or you have not done MCQs at all, you can decrease it. Or if you think that you have already covered MCQs in a great detail, then you can reduce this to 3:1. But the standard recommendation is 2:1. Okay, so if somebody is reading 9 hours in a day, 6:3. If somebody is reading 12 hours in a day, then it has to be 8:4. So depending on how much time are you able to give to that particular subject, divide these 70 days into individual time. Okay, so let's do a random division. Let's do a random division. 3 3 3. Okay, 3 3 3. Or there is one more way that you can do, is depending on that which is a short subject or which is a long subject. So let's take it from a short subject. So let's say skin, anesthesia, radio, psyche, ortho. So what I will be doing is that I will be giving them into 1 1 1 1 1. Forensic medicine is again a short subject, so I'm gonna give it a 1 day. Okay, then look at the medium subject like ENT, give it 2 days. Ophtha, give it 2 days. Pediatrics, give it 2 days. Okay, then you have got medium subjects. Pharma, you can give 3 days. Micro, you can give 3 days. Then you can give 4 days to them. Medicine, and then we're gonna divide them. Maybe anatomy is 3 days, fine. And then you can give 4 days here, 4 days here, and let's count the number of days. 5 is here, 43, so 48. So that means you can still have more days, so you can add on to the things. So add one more here, add one more here, add one more here, add one more here, add path. Sometimes students feel it difficult, so maybe you can add two here, or you can add 3 here, 3 here, and you can add one more here. Okay, so for okay, so that is how. So the idea of telling you this particular part is that there is no limit onto that, but that is how you're gonna make your own schedule. So if I'm gonna complete with this particular part, so you have got 63 days. Still you have some time, so you can add onto more days depending on, like for example, I have given only 5 days to pharmacology, and let's say when you have read the pharmacology in your first reading, so you were slightly short of that, so you may add 1 or 2 days into that. Okay, so please make your schedule like that. Again, you have to consolidate your subject in that particular time. Make your timetable according to that. Which subject you have read less, which subject have you read more. Try to focus on those subjects which were slightly weak at the early time, and put those subjects which you think that you are pretty strong at a slightly later time. Okay, second important thing is that sometime that you don't feel like reading one subject, so you can club the 2 subjects in particular day. Like for example, what you can do is you can club anatomy plus let's say 2 more subjects like radiology and orthopedics. Okay, and what you will do is, so you have total of these 6 days. So what you're gonna do is that you are reading in the initial half of the day anatomy, and in the later half of the day or radiology. How to take up those subjects? Pick up a subject which you are weak and pick up a subject which is strong. Read that strong subject in the later half of the day and read the weak subject in the earlier half of the day. Okay, so make your schedule according to that. Try to follow this 2:1 pattern. 2:1 pattern. Okay, now in this one pattern, make sure that you are doing some subject wise test and very important full course test. Very important full course test, and that is the reason that we have for all our students, we have uploaded lot of new tests, full course test on the app. Try to give them. We are providing this simulated environment to you in the form of the CLT. That will be really helpful, that will reduce your anxiety. Make sure that you are writing grand CLT. Grand CLT will be a single most deciding factor which will tell you where do you stand. Okay, so apart from the grand CLT also, you have to give at least 2 to 3 full course tests per month. At least 2 to 3 full course tests per month. You need not to go anywhere. Put it onto the app, So one could be a CLT, Champion Life Test Series, that you can give in the simulated atmosphere, and 2 full course tests per month additional, where you will assess yourself, where you will see where are you going wrong. Okay, so if you did the 300 questions, then try to analyze that. Now let's move to the next part. Let's say that you have done the paper. Now how to analyze the paper, how to see whether you have done the right thing in the paper, or there is something else that is required in that particular paper. So what you have to do is, now let's see this. Okay, so let's see that you have done a 100 question paper. Okay, 100 question paper, and your 50 questions are right, 40 questions were wrong, and 10 questions you have not attempted. Okay, we're going to talk about that not attempted question in the next video, but now let's first focus on this. Okay, so now I will think about first this 40 questions, why they are wrong. Now these 40 questions could be wrong because of 2 reasons. One, you have not read that topic. You have not read that topic, or you have forgotten that topic. You have forgotten that topic. Okay, so if you have not read that topic, see, the remedy is different. Now the remedy is, then you have to read it. Simple. Open the book. If you have time, read this particular topic. Ideally speaking, this is not acceptable. All the ranks are dependent on this, that how much are you forgetting. Okay, now why you are forgetting? Why you are forgetting? And again the point is revise, revise, revise. Please remember, practice is one of the most important point that will sail you through. I will give you a very small example of the practice that I have observed today. My daughter appeared for a cricket tournament today, and it's an under 7 cricket tournament. You can imagine the mind of an under 7 kid. Okay, so I feel that all kids are same. All kids are same. So it's a match between the 2 schools, one school and the other school. She's in a junior school, so they were very excited for this particular cricket tournament. So they were practicing for the last 1 month. Every morning, evening they were practicing. So, and they had a match today. So when this match happened, the other team did not practice, and you can't imagine, it was a 10-over match. Their team scored 170 runs in the 10 overs. 170 runs in the 10 overs, where the other team were managed to score hardly 40 in the 10 overs. Okay, so the idea of telling you this particular part is that the only thing that created the difference, a 7-year-old child, I feel they have got equal brain, they have got equal passion for the sports. You can't discriminate them on the basis of the level of intelligence. The only thing that discriminated them was the practice that they happened. So please make sure that you are revising, you are practicing. That is the only thing that will make difference. Please remember, no more extra burden onto you at this point of time. Even if you have not read 2-3 topics, it will not make much difference. But if you are not able to recall the things that you have read, that will make all the difference. Try to follow 2:1 pattern. Two part of your day should go to the theory, and 1 part should go to the MCQ. But if you have not done the MCQ, you may reduce it. If you've done a lot of MCQ, you can increase it. But that's an ideal. Ideally, though there is no time limit, but ideally at this point of time, you should give at least 12 to 14 hours to the study. At least 12 to 14 hours to the study. But I strongly disagree on that you go give it by a clock. Try to give your maximum. Because it is the output that will matter, not just the input. Okay, so try to follow this, and do write your queries. If you have any specific query, share them on our premier group, and I will come up with a new video where that query will be addressed. Okay, thank you very much. Thanks for the patient listening, friends.